Hey everyone, it's Dr. Rick. I'm doing a remote unboxing on saffron. Saffron comes from a plant, hard to cultivate, enough active ingredient to put into a capsule, but that's why it's a little expensive. The data out there, even with regards to meta-analyses on saffron, are strong. They're very promising for mild to moderate depression, for PMDD or premenstrual syndrome, is what we used to call it before, even with Alzheimer's disease. And for some people that don't have any mood change with this weather, just have problems with irritable bowel syndrome and that's all, or it's flaring up, I'd say give it a try. Does this herb help you? Does it cause side effects? And can it be studied or can it be comparable to true prescription medicines in mild to moderate depression? And the data does show or support the fact that saffron has very limited side effect, and it also has mechanistically been studied in animals as far as how it works. With regards to treating symptoms of mild to moderate depression, especially with seasonal affective disorder that's starting to show its head now, in the patient population that I take care of, there's been a slight bump up with symptoms of mild to moderate depression. Whether patients had the depression before, or they're just feeling blues or sad because of the decreased amount of sun, because of lower temperatures, and because of the hallmark of end of summer. We have a little bit of a stretch before getting to Halloween, the first holiday, and when the summer ends and the holidays haven't begun, you can have some issues with feeling sad. I have done videos in the past for L-theanine, which is a great herb to use at night for sleep and mild depression and blood pressure. I've also done one on light box therapy, and I think I have an old one on vitamin D. So if you're a little bit on the low side, even if you sit out in the sun, if your numbers do not get to the point of 70 to 80 on your blood test results, then you probably have to increase your exposure to vitamin D as far as sunlight, watch for the melanoma, or just taking vitamin D orally. I think it's important to supplement vitamin D, especially with going into fall and viral season. But with regards to the use of saffron, there's a couple of benefits. So if you have an Alzheimer's patient on a medicine already, it would help with memory, because a lot of Alzheimer's patients have problems with memory and depression. You'll have to look at the studies yourself, but if you're not familiar with biostatistics to figure out which studies are good, which studies are unreliable or statistically significant, then ask your doctor. And by the way, this is not meant to be medical advice, so please do not do anything on your own. Take this information to your doctor and see how it pertains to you, especially if you're on medicines. So that would be the next thing. Whether you have depression with Alzheimer's disease and you're on medicines for that, or mild to moderate depression where you were maintained on a medicine like an SSRI, that would be Zoloft, Paxil, Prozac, or if you're on a different medicine like imipramine. Regardless if you've been stable but you're starting to flare up, I think it's important to get a visit with your doc and figure out if there's something new going on. If there's nothing new going on with regards to your thyroid, traumas, psychological issues, or anything organic, then it would be worth it to try this while you're waiting for your doctor visit. In all truth, it usually takes about 2 to 3 weeks to get a doctor visit. One of the beauties with saffron, especially if it has ashwagandha or rhodiola like U-theory carries, it can help the adrenals. I do believe a lot of us with the change in weather have changed our sleep patterns, and rhodiola and ashwagandha, not to detract from our talk on saffron today, they do help the adrenals get back into shape and maybe reset your circadian rhythm. The L-theanine I mentioned before is great at night and for depression and for blood pressure and for insomnia. That's one of the things I've always been impressed with is my patients who want to avoid medications, whether it's placebo or not, when they start supplementation as far as fixing deficiencies, they start to improve. Placebo effect can take a very powerful role in changing your disease process or your symptoms. Typically, placebo doesn't last that long. And I have patients going into the next season doing great with their supplementation. Which brings me to my last point. When you introduce saffron, in addition to your current prescriptions that you maintain, I think that it can give you a slight bump up in the way the medicines effectively take care of you. Like kava kava for anxiety and saffron for depression and mood disorder, it's important to have your doctor check your blood tests, make sure you're stable, make sure there's nothing else that's causing your flare-up, and then maybe ask your doctor if you can implement this while you're waiting for the follow-up visit. Most of the studies that were evaluated in the meta-analysis hone in their dose to about 15 milligrams twice a day or 30 milligrams a day for about 6 to 8 weeks. So if you have a vitamin that gives the same effect as 2 prescription medicines with less side effects, I think it would be fair, especially for those patients who have high sensitivity to side effects, to implement saffron while waiting for the visit with a psychiatrist or the psychotherapist, which is a really important point. You cannot just tackle your depression with a supplement or a food change or exercise or nature therapy. You have to be implementing a plan to perhaps increase your therapy visits per week or month, checking out with your psychiatrist or primary care doctor that you have haven't developed a new symptom on top of your mild to moderate depression. Make sure that your gut is absorbing the medicines you're on or the supplements that you're taking care of. And there have also been some limited studies on saffron's effect with irritable bowel syndrome and gut-related dysfunction. Till we get into 2023 and the holidays, please take care of yourself. If you have any thoughts, ideas, or plans for suicide, get to the emergency room. If life is just a little bit tougher than usual and you're one of my patients, talk to me online. I'll give you an idea about how to start. Take care of yourself in the meantime, get some good sleep, exercise, eat properly, and then hopefully we'll get through this next season together. Also, don't forget to like and subscribe to my YouTube channel as it supports me doing more videos for you guys. Stay healthy, try to find some happiness in this next couple months, and I'll see you at the next video.